to our virtual Walk with the Future Doc. My name's Lauren. I am a third-year medical student at WVU, and I'm just going to give everyone a quick overview of what to expect for the next hour. First, we're going to be hearing from Dr. Costello about the topic of advocacy in medicine, a marathon, not a sprint. And then as we all walk together virtually, she'll be able to answer any questions that anyone has. Our Facebook page is WVU Walk with the Future Doc, and this page will be updated with information about future walks and is going to be the best place to look for updated information. And then the last update today was that the walk is going to be recorded, and everyone should have received like a little pop-up notification saying that you're okay with it being recorded, and only the audio portion will be released. So the video portion will not be recorded and released. Thank you for joining us today. It's always nice to see everyone, even if it's still virtually. Now I'd like to introduce everyone to Dr. Costello, who's a pediatrician at WVU Medicine. We're really excited to have Dr. Costello join us today and talk about advocacy in medicine, a marathon, not a sprint. So I will turn things over to her.
Well, thank you so much, Lauren and Mia, for the invitation. Hello, everyone. So we're going to talk today about something that I'm very passionate about. I started really engaging in advocacy in kindergarten. I remember going with my parents to the Jerry Lewis telethon to make a donation on behalf of my kindergarten or my preschool, I think it's kindergarten class. And so throughout my journey in medical education, advocacy has certainly become one of my interests. So I know I'll display this, but where I'm walking today is an area where I think people usually associate with advocacy, and that's this place, which is the College of Law at West Virginia University. But I hope today I can prove to you that people who train in this building afar, which is the Health Science Center, should also engage in advocacy, and hopefully convince you that you have the skills to be able to engage in advocacy, and that it is part of our profession of medicine, and that it really is a marathon and not a sprint. So when we talk about advocacy, what do we mean? And I always like to throw it back, and I know we're going to do Q&A here in a little bit, but why did you go into medicine? We have our Dean of Admissions on here. She reads literally thousands of applications every year as to why people want to go into medicine. So for any of the students on here, I would ask, what motivated you to go into medicine? Any takers? Anyone want to share? We know you had to write it at some point, and you probably got asked it on your med school interview too. All right, well, maybe everyone's still getting warmed up, but what are some common things that people usually say, at least when I was on the admissions committee and when I've talked to students who want to go into medicine, they usually say, we want to help people, we really like science, we want to be able to make an impact bigger than ourselves, and really that's what advocacy is. And we'll talk a little bit about the different types of advocacy and where you can engage in advocacy. But being an advocate is really intertwined with our profession of medicine, and it allows you to move from caring for one person to caring for a broader population of individuals. So advocacy at its basis, and I think many a times, as I said, being at the College of Law, is the thought of engaging in policy and public support for a certain area. And that's really what advocacy is when you talk about it being defined, is just public support for a position. I really think of advocacy as speaking out on your patient's behalf and also on behalf of your profession as well. And so you don't have to be an expert in the government process to be an advocate in medicine. you really just have to be aware of the situations that your patients face. The former president of the American Academy of Pediatrics, Sandy Hassink, usually defined advocacy as this. Advocacy is about creating a situation in which change can occur. So as you're journeying through medical school, or if you're already in practice full time, you might see an injustice. Perhaps it's you have a patient who doesn't have access to nutritious foods, or you have a patient who doesn't have health insurance. Those are what many in pediatrics would consider an injustice. And so as a physician, you can use those experiences to then speak out on behalf of your patient and hopefully enact policy change that will impact them. So when I think of advocacy, I think of it at 4 different levels: individual, community, state, and federal. So individual advocacy is probably the most overlooked part of advocacy. When people talk about advocacy, people tell me, oh, I don't have time to get involved in advocacy. I'm too busy. I don't like politics. I don't know how to do it. But really, people don't appreciate that they're advocating every day. So when you're talking about individual advocacy, this is that direct one-on-one advocacy. So maybe it's you have to call an insurance company to get a procedure approved for your patient. Maybe it's calling the insurance company to appeal why they didn't pay for something for one of your patients. But that individual advocacy can also happen within an institution. In the field of pediatrics, there's many times I would have to call as a resident, or even now as an attending, to say, hey, my patient really needs this procedure. They need it with sedation. How can we make this happen? And work with different departments, whether it's getting an MRI or another test, to make sure that my patient gets that. So it requires picking up in a little bit of an extra effort, but it's really speaking out on their behalf that then can create change. The next area that I like to talk about in regards to advocacy is community advocacy. So this is moving beyond that individual level and more so advocating for your community. So sometimes people like to say politics is local. I think that's very true. I remember when I was in medical school, Morgantown was trying to pass an Indoor Clean Air Act, and many of my classmates walked down to the Board of Health, which is right below the health science campus in the Monongalia County Health Department. And there were many of us in our short white coats there in support of passing an ordinance that would eliminate smoking inside buildings. And that was fortunately able to be passed. So when you talk about community advocacy, this is advocating in your community. This could be participating in health fairs, speaking at schools to educate children, raising awareness about an issue, whether it's vaping, which has been a big area of concern that we've seen in the pediatric population. I know that there's been many medical students working to develop resources that they can educate in regards to vaping use amongst teens. And so advocating in community is stepping out beyond the walls of the hospital or the clinic and really trying to raise awareness or impact change in your local community. We've seen a lot of that this year in the coronavirus pandemic, particularly when it comes to education. So many different boards of education have enacted different policies that works best for their county. And there's been many physicians who've been engaged in that process in order to determine what would be the safest way to get children back to school. Additionally, in the pandemic, we've seen a great deal of local leadership when it comes to just different ordinances, whether it's wearing your mask, which I'm doing today since I'm walking where there could be other people, as well as whether it's testing events or different procedures that deal with the pandemic at a local level. The next step up in advocacy is state advocacy. This is probably what I would think state and federal advocacy, what most people relate to when they're talking about advocacy. So state advocacy is really trying to change policies or enact laws that impact individuals at the entire state level. And so in West Virginia, we have a pretty unique legislative session. It's a 60-day session in the early part of every year. this year, because it's an election year, it will be a little bit later, but it lasts for 60 days. We have 100 House of Delegates, 100 individuals in the House of Delegates. We have 34 senators. And then we have, that's the legislative branch. Then we also have the executive branch, which is the governor, and many different regulatory agencies, including the Department of Health and Human Resources, that oversees a great deal of things that impact health, from payment to nutrition to the child welfare system, many different areas that fall through or fall under the Department of Health and Human Resources, including the main drivers of the pandemic response. And then there's also the judicial branch. And so West Virginia has a Supreme Court of Appeals where there's 5 justices. And they also have a lot to do with policy that I think individuals sometimes don't necessarily appreciate, how much the judicial system really does impact the practice of medicine in regards to laws and regulations. Then last, when I talk about advocacy, I always think about federal advocacy. So this is more so in Washington, D.C., again, legislative, executive, judicial branches of government, where there's policies that impact individuals across the country, whether it's payment, substance use disorder, funding for research, loan repayment. I don't know if anybody on here has any loans. I sure know I did in medical school, to a wide variety. You know, this group is very focused on nutrition, which is great, but programs like SNAP, or the Supplemental Nutrition Assistance Program, or WIC, Women's, Infant, and Children, those are policies that are set forth by the federal government. Interestingly, SNAP is regulated through the Department of Agriculture. Most people would be like, why does the Department of Agriculture manage a food program for families or for individuals? Wouldn't that be something more related to health? You would want people with a health background making decisions as to what are considered nutritious foods. But in our government, that program is run through the Department of Agriculture. And so as physicians, how can we make a difference in these settings? And really, it's the stories we have, and sharing those stories, always HIPAA compliant, but sharing those experiences of how our patients are impacted by policies that are set forth. So in West Virginia, we have a really strong immunization policy, in which the only exceptions we accept in regards to being exempted from an immunization is a medical exemption. There's only now 5 other states that follow that lead. For the longest time, it was only us in Mississippi. And then slowly other states started adapting our policies. As a result, we have some of the highest school-aged immunization rates in the country. We could do a lot better when it comes to early age immunization, but we get individuals caught up when it's time for school entry. So that's a policy that we as pediatricians always really work hard to maintain that policy, even though every year people try to weaken that policy and allow non-medical exemptions, which we in the pediatric community feel would be very devastating and lead to decreased immunization rates, because that's what we see in other states that don't have strong policies like ours. So we can go to the legislature, share stories of how individuals are impacted by this, talking about herd immunity. Maybe it's that child who has leukemia who benefits from everybody else around them having vaccines, because while they're undergoing treatment, they're not able to get vaccines perhaps. And so by having everybody else immunized and having that strong policy, we're able to ensure hopefully a safer space for that child. So really, advocacy is about speaking out on behalf of your patients, using those stories of where we see these policies impact our patients. You can do it in a variety of ways, whether it's reaching out to your elected representatives, they work for you, whether it's writing an op-ed or a letter to the editor, where you can then express or raise awareness and ask others to support a position that you feel is important. It could also be engaging on social media. I like to call myself a hashtag tweediatrician. So I tend to engage in tweet a lot, whether it's tweeting at elected representatives or raising awareness about an issue. And then I would be remiss if in an election year, I did not say one of the most important things you can do as an advocate is to vote. So be an informed voter, learn the issues, see where candidates vote and what they support when it comes to different issues. For me personally, anyone who's vaccine hesitant is a non-starter for me, because I know that I think based upon science, we know vaccines are safe, effective, and save lives. And so I think it's very important that we have elected representatives who also trust science and are willing to uphold our strong immunization policies. So as we are just over, I think we're at like day 24 left to the election, make sure that you're registered to vote, that you have a voting plan, and encourage your friends to vote as well. I'll just end by saying, whenever we advocate in medicine, we stick to science. It's nonpartisan. It's not a matter of being red or blue or Democrat or Republican. It's really about speaking out on behalf of your patients and using science and the evidence that we have, along with our experiences of our patients' stories, to enact change and make a real difference in the lives of our patients. In regards to it being a marathon, there are going to be times that you're going to advocate on the same issue for many years, and you might not feel like you're making any progress. But like with a marathon, if you keep going and you sustain for the long fight, you'll eventually see impact that happens. Sometimes it's small, sometimes it's large, but it all makes a difference on behalf of our patients. So thank you so much for letting me talk a little bit about an area that's really I'm passionate about, and I hope you all, I think many of you on the phone I've already seen are advocates in different ways at different levels, but I hope you've realized that regardless if you know it or not, you all have advocated either on behalf of your patients or your profession. Just being here today, showing the importance of activity is a way to show and set an example of why it's important to get engaged. So thanks again. I look forward to answering any questions.
Thank you so much, Dr. Costello. So now we'll open up the floor to any questions that anybody has. If you want to send them in the chat, you can go ahead and do that now. You can send them to everyone, or you can just send them to me, and I'm Mia. But I'll start off with a question. Dr. Costello, when you chose pediatrics as your specialty, did you know that this was something that you could have a platform in advocacy in? And how do you think that differs, like your advocacy in pediatrics differs from advocacy for maybe adult medicine or geriatrics or something like that, a different specialty?
Well, thanks for the question. So this is I don't think it's that much of a secret, but probably people don't know very much, but I'm actually a med-peds trained physician. So my residency was in internal medicine and pediatrics. I now only practice pediatrics, but part of my rationale for going into med-peds was I did, in addition to pediatric medicine, I've always said I'm big P little M. Many of us in med-peds are, we have one or the other that we like more. And so I've always been big P little M. But I really wanted exposure to adult medicine because I thought it would help me in advocacy. And when I've given testimony in regards to immunization policy, and I've testified in our Senate education meeting, I have made reference of stories of taking care of adult patients who were inflicted by now vaccine preventable diseases, and why it's so important and how we've advanced for such a period of time. But in regards to pediatrics, I do feel pediatrics, it's ingrained in our profession because the population we represent, for the large majority, unless they're 18, they can't vote. And so many of the times they don't have a voice. And so most of my advocacy training has come in work with the American Academy of Pediatrics. I got involved in the AAP as a second-year medical student when I was looking for a professional home. And it really has been that home and so much more, and really taught me a lot about advocacy and how we can engage as physicians. And now I'm lucky enough to serve on our AAP Committee on State Government Affairs, which helps in regards to state policy and advocacy initiatives for the entire country in regards to our AAP. So I do feel like our pediatric profession is very committed to advocacy, and particularly child health issues. But that goes across the board. And I think I've seen more and more over just the past few years, other specialties as well, whether it's surgeons or the American College of Physicians, ACOG for OBGYNs, psychiatry in regards to substance use disorder. I mean, really, I think there's been a more active role that physicians have played in regards to speaking up. One of my favorite advocacy sayings is that if you're not at the table, you're on the menu. And I think a lot of people have really realized that, there's decisions that are being made for our patients and for our profession. And it's really important that we're in the room at the table, giving the perspective of our patients and our profession so that the policies that are enacted are beneficial and not detrimental, or that policies that maybe exist that do fall short are being improved to make a better impact. So for me, I always knew I wanted to work with kids in some variety. I took a different route to get there doing med peds, but now I solely practice pediatric medicine. And then I've been doing some public health work working with the state on the pandemic response. So I think that the stories obviously change, but it's really important, regardless of the age of the person or the patient population that you're advocating for, that you use those stories to help illustrate your point and really humanize whatever the ask is when it comes to advocacy or whatever area you're trying to raise awareness about. Hopefully that answered the question, but PEDS is the best. I know Dr. Neild is on here, so it's fun. We get to, take care of children, and they always bring a smile to my face. So it really is a humbling and really fun job to have.
Thank you.
So I have a question. Hi, this is Meg. I was just wondering if you could talk a little bit more about what kind of advocacy you guys are doing for the pandemic, since I know that you're very involved with that.
Yeah, so great question. I think a lot of advocacy when it's come to the pandemic has been in different ways. So obviously we've had a lot of telemedicine, which really prior to the pandemic, I think there were individuals who wanted there to be more robust telemedicine services, particularly in a state like ours, where we have a lot of patients that live in rural communities and may not have reliable transportation. And so there's been a great deal of advocacy from physician groups. Someday this week, I think it was Tuesday, I was on a call. I was invited by Congressman David McKinley and then Seema Verma, who's the administrator of the Centers for Medicare and Medicaid at the federal level. And so we had a talk with her. It was a whole hour chat, just discussing the impact the pandemic has had in regards to healthcare delivery in West Virginia. We had nursing home representation, physician representation, and we talked a lot about telehealth on that call in regards to payment for telehealth as well as access to telehealth. I brought up the issue of telephonic services in regards to physicians being compensated for telephonic services to deliver healthcare. That's been one of the areas that I think there's been a lot of advocacy. In regards to the actual science of it, I think that there's been many different physicians promoting the recommendations, whether it's washing your hands, wearing a mask, staying physically distant, really weighing in on the policies. There was a lot of behind the scenes work in regards to creation of the school health guidance. Since March, I've been working for the state health officer, kind of as like an advisor. And a lot of the advocacy I do is behind the scenes because there will be a policy set forth and I'll have the opportunity to review it. And then I'll make recommendations saying, this is what the AAP is recommending, or this is what, this is an article in the whatever reputable journal you want to pick. And this is, the guidance that they're recommending so that we can have, as much evidence as we have driving the policies of the pandemic. Obviously, it's been challenging because information changes all the time, which is a good thing. We're learning more as we go through this. We got some things right. We had some missteps as well. And so we're continuing to learn. That's what science is. But it does create some challenges in regards to messaging to the public. So I think there's been a lot of what I would call advocacy for adherence to these public health recommendations at the community level. There's been many different op-eds penned, different organizations, whether it's AAP, the American College of Physicians, the AMA, the American Medical Association, really advocating for adherence to science in the whole pandemic response. Right now, the biggest thing that I'm working on is I'm one of the leads of the COVID vaccine distribution plan in the state. So there's a group of about 20 of us that are in charge of the entire vaccine development for a potential COVID vaccine, how that will be distributed, the logistics that go with that. We have a medical advisory group to look at the science that comes out surrounding that. And so it's given me an opportunity to kind of, again, be at the table to discuss. One of the areas when it comes to COVID vaccine, I was just on a call with the National Governors Association and asked this question to the main pharmaceutical companies that are manufacturing these vaccines, like, when are we going to test the vaccine in children? And there's only one company that's testing to age 16. So obviously what we've seen with COVID is that it tends to disproportionately impact elderly patients and then also disproportionately affect minority communities. And so we as the AAP, or the American Academy of Pediatrics, have been advocating to ensure that children are going to be involved in these clinical trials as well, because we have learned and continue to learn that particularly teenage children can spread the virus. And if we really want to establish, community immunity and have the capability to get back to our more normal or pre-pandemic life, I think we're going to need to have a mass immunization that certainly includes immunizing children. But we have to make sure the vaccine is safe and effective. And this is a struggle in pediatric medicine as a whole. Drug development usually comes to children last because they want to make sure it's safe in adults, and then they slowly work their way down. And so children tend to be kind of last in line to get, be enrolled in clinical trials that look at the safety and efficacy in that population. So those are some of the things that I've been working on, but I think it's really been a collaborative effort. And I didn't talk about that a lot, but Advocacy Real is about forming coalition and forming relationships. So, obviously any individual can make an impact, but you have a stronger impact when you have a coalition and when you can build those coalitions, whether it's working with local partners, working with organizations, and all advocating together really can strengthen your advocacy efforts. So really a lot of my role has been forming and strengthening these collaborations between, government and private sector and other public sector agencies to have a more robust and cohesive pandemic response.
Thank you. That was really interesting.
Hi, Dr. Costello. This is Lauren. I had a question regarding still regarding advocacy, but more on the lines of how do you talk to patients and families about family members advocating for the patient or the patient advocating for themselves?
This is a great question. So in the early part of my career, I worked in cystic fibrosis, and I would give a shout out to them. I think they do this probably better than most groups I've seen, where they have very, very robust advocacy efforts where they engage parents and patients. Many of my pediatricians colleagues, I'm a pediatric hospitalist, so I work a week at a time or 2 weeks at a time, and then I have time that I work on public health or academic type things. So it's a little bit of a different design than like a clinic or outpatient-based setting where you may be there multiple days a week or every day a week if you're in private practice. And many of my pediatric colleagues, I have it, I forgot it today, I should have brought it, but it's called Voter, so VOTER. It's a campaign that helps physicians themselves get registered to vote, but then also have their patients and their families register to vote. There's like a QR code that people can scan that connects them to being able to vote. So many pediatricians I know have led a strong campaign or just posting signs in their practices that say to vote, not endorsing a candidate or not. Because again, whenever I'm advocating, I really, stick to the science and remain nonpartisan. Another former president of the American Academy of Pediatrics, Bernard Dreyer, always said, we are nonpartisan, but unabashedly pro-child. And now he also says we're pro-science. And so I think that obviously, I would never, I think, I would never push a person to be like, who are you voting for? That's not the role that I feel that you should play. But it happens more than you would think. There's a story I usually share. One of my colleagues was seeing a patient in her adult clinic. He had back pain, had tried many different medications, including opioids. And the only thing that seemed to work were lidoderm patches. But the lidoderm patches were not covered by his insurance. So the mom of the patient was like, well, you should call Joe Manchin, who's one of the United States senators in West Virginia. And so the physician did. She was a resident at the time. She's now on faculty. She called Joe Manchin, shared the patient's story, and they were able to get the lidoderm patches approved. And so the patient was able to get his lidoderm covered, because traditionally it had only been covered for post-herpetic neuralgia or pain after shingle infection. So that was just an example of how, it was the patient's parent's idea. It was an adult patient, but the physician took that extra step. I think that's a great example of individual advocacy that has the potential to then impact more people if it can be a policy that's enacted that then impacts more than just that one patient. But I think that depending upon what the issue is, I personally, just as I keep like an interesting patient list, I also have a list of advocacy stories where there's been a situation in which I felt, a person didn't have health care, or, their access to nutrition was, they were very food insecure. Different examples like that I keep, so that whenever I'm going to advocate, then I have those stories. And sometimes, there was it was a couple years ago, the Washington Post was doing a story on the Affordable Care Act. And so they reached out and they wanted patient stories. And one of my patients' families, we did, obviously we had to get permission. We worked with our media folks, but the family was willing to share their story. And we're featured in that article that, obviously has a pretty broad reach of being a pretty well-known newspaper. So those are some of the examples. Obviously I never force them. There's been situations where we've had patients that we, said, would you be willing to share your story? And they were too reluctant for a variety of reasons. And that's personally, that's absolutely fine and should be encouraged. And we should never be forcing patients to engage in that type of work. I think part of our role as a pediatrician is to empower people, whether it's empowering them to, make healthy decisions for their lifestyle, make recommendations for them to be able to do that, and instill hope in the process. And I think a lot of that goes, when you're talking about advocacy, people might be frustrated. And so you can say, well, have you, reached out? Or, I've told my patients, if they've complained about something, I've told them, well, yeah, interestingly, you say that, like, I just, sent a letter to my congressman, and, emphasizing those same points about, why we need whatever the issue was. So those are some of the ways that I think you can engage. And obviously, I think it depends upon what the underlying ailment is. I know a lot of colleagues, that are patients who say have like diabetes or type 1 diabetes. There's a lot of advocacy around that. There's a significant amount of advocacy around childhood cancer research. So a lot of times it's a matter of just being there and supporting the patients and their families when they're engaged in this work, and being there to support them and provide any resources, because it is very powerful when when families that are impacted and have really challenging stories and heart-wrenching stories, when they choose to advocate, it really does, I think, make a considerable impact on the policymakers, because they're seeing that firsthand account of what the policy that they're about to vote on, how it would impact a real person.
Thank you, Dr. Costello.
And please don't let me be the only one who talk. I know that there's other people on here who's engaged in advocacy in different ways. So feel free to chime in and share any stories that you have as well.
Since we are focused on health and wellness, can you talk a little bit about what you're doing in terms of that for pediatrics, like the SNAP program or other resources?
Yeah, so through the AAP, we have a chapter in West Virginia. And full disclosure, I'm currently the president of that. And every year we have what we call advocacy priorities. It's in, we like to call it the blueprint for children, and it has our advocacy priorities. We have a meeting tomorrow of our larger executive team that will, determine what our advocacy priorities will be for 2021. And one of there's a few areas that we have that address health and wellness. Probably the biggest is obesity prevention. And so we have a very active member. Her name is Dr. Jamie Jeffries. She runs Key for Healthy Kids, that has many different grants and projects in regards to writing prescriptions for exercise, writing healthy prescriptions, providing fresh fruit and vegetables. It also involves having local farmers markets, even bringing them to physicians' clinics and hospital settings to better promote nutrition in that regard. And so there's a significant amount of advocacy in regards to obesity education and funding for those type of efforts, whether that comes from private grant funded or public funded entities. An area that has also been a focus has been a sugar sweetened beverage tax. So many people have seen that probably in bigger cities like New York, I think was pretty, well known for enacting that type of policy. We've always had bills like that introduced. I will say they haven't made it very far, but we have always tried to push that sugary sweetened beverage tax as a deterrent, that would then better promote better choices. And so those type of areas in surrounding obesity prevention, as well as ensuring that there's physical activity in school. I think this year that looks a little bit different because we have so many students engaging in virtual learning, but still emphasizing the importance of physical activity. And then in regards to SNAP and WIC, I think that's an issue that really does come from the federal level, but then also at the state level in regards to funding for those programs, because every year those programs try, I wouldn't say it's maybe every year, I would say more years than not, there's attempts to cut funding to those programs or dictate the type of food that is qualified for SNAP or WIC. And so there's been ongoing efforts by the American Academy of Pediatrics to, one, make sure those programs remain, because there are some who would like those programs to be eliminated in general. So there's advocacy to make sure those programs remain, that they get funded and they get funded adequately. There's a lot of work that goes in regards to making the process less cumbersome for the enrollee, so that there can be better access to that. And then I think the overarching thing for all of this is to ensure that there's access to healthcare. So we know that individuals who have health insurance are more likely to seek medical care, both preventative and acute care. And unfortunately, we're seeing a decline in child health coverage. We had been on a steady rise from about 2012. We had gotten to above 95 percentile, or 95% of kids being covered. Unfortunately, including in our state, we're seeing a decline in some of that. And so there's ongoing efforts to ensure, children are getting access to health insurance, because again, we know that those who have health insurance are more likely to seek care and receive the medications they need than those who do not have health insurance. So those are some of the areas that we focus on when it comes to health and wellness, and particularly SNAP and WIC. And one, just a lot of times it's educating the legislators. We have a policy elective for fourth year medical students in Charleston, where you can go and actually engage in the advocacy and policy process. And I would say the biggest thing that students always say is they're always surprised at how little the policymakers know about any particular issue. And they're always surprised that they're like, how does this person not know this? But our government is made up of people from a diverse array. So you have teachers, engineers, business owners, insurance, holders, bankers, coal miners. We also have some physicians. There's 2 physicians in the Senate and then 3 in the House. But as you can tell, that's not a really large number when you're talking about 134 individuals. So really a lot of our job is to educate, because there's a lot of misinformation, and to educate about what these programs do, and kind of debunk any myths or falsehoods that may be presented. And the thing about being a physician is that we're a trusted voice, and that's where, using science and data to support our ask is where it really becomes beneficial and impactful. And then you add in a patient story, and then that really humanizes it and resonates with the policymaker. So there's a question in the chat about, do you have any advice of how to become more engaged as an undergrad at WU wanting to attend med school, especially now with the pandemic? So great question. I think that when I was an undergrad, I was pretty involved in student government and the Student Health Advisory Board. So again, emphasizing that importance of community or individual advocacy is really important. I think, one, just being a good example, adhering to the guidelines, wearing a mask, staying physically distant, washing your hands, promoting, the importance. It's flu season. Hopefully everybody on here got their flu shot. I got mine 2 days ago, took my flu shot selfie. Make sure if you haven't already got your flu shot, that's something that you do here sooner than later, and then encourage others to do the same. So whether it's awareness campaigns for your fellow students about like the importance of flu vaccine, or one of the very first things I did as a undergrad student was participate in a voter registration drive, and also a program that helped students secure absentee ballots. So there's different things you can do like that. I think the pandemic has made some things challenging. We have to do more things virtual, or not physically in the same space as somebody else, but there's still a lot of work that needs to happen. And so whether that's, again, posting flyers in areas that do tend to be highly trafficked, through different programs that are already in existence and just amplifying those, versus I think it's always good to volunteer when you can in different groups, whether it's Health Right or there's different community health programs that are out there. The health department has been having some volunteers, individuals who did a contact tracing and pandemic response course that was offered through the university. We were able to train about 250 volunteers. So those were some ways to engage in advocacy. So I think finding what is available, or if you identify a need, finding other individuals and creating a program that you feel addresses that is always a way that you can get involved. But I always give a shout out to student government or student health type organizations. I know there's also a lot of work in regards to global health. Obviously, in the pandemic, those look a little bit different, but the information sharing and the education, I think, is going to be an ongoing important role that we all can play as we continue to progress through this pandemic.
Dr. Costello, it's always wonderful to hear you talk about advocacy. You're always really inspiring to all of us in that regard. I wanted to ask, so when it comes to speaking to legislators, I know that they kind of see us as more of the experts, whether we're physicians, medical students, or otherwise health professionals. But what about the public? What do you think is the most effective way of kind of educating the public on certain topics, whether that's, is it social media? Is it making videos? Is it writing articles? What do you think is the best way to educate the public?
Well, thanks to Dr. Cottrell, the president of SEDO, which is Student Advocates Impacting Decisions on Healthcare. So a group that was really formed out of advocacy, a group of students who are now second-year residents felt like they didn't have enough advocacy exposure in their medical education. So we created this group, and Brooke does a great job as our current president. I think it's a great question. There's a whole, to give a plug for SEDO, we're going to be having a advocacy messaging talk here coming up in just a week or so. But I think it's a great question. It's really a lot like talking to patients, honestly. I think the AAP has really adopted this mantra that I try to follow, like be first, be right, be credible. And so I think you want to be truthful and you want to use science to back that up. But I think the tricky or the challenging part can be is making sure that it's relatable and consumable, to talk in a way that individuals can understand. So whether that's, making sure that you're writing at a proper level. I think a lot of times people talk about writing at an 8th or 5th grade level, when really in our state, you have to even write at a lower grade level than that. So you're talking about a 3rd grade level. I think a lot of criticism of the messaging around the pandemic was that it was too broad. So people were like, oh, social distance, but what does that mean? So saying exactly what that means, staying 6 feet away from someone, meaning or only go out for groceries one time a week and only send one person to the grocery store. So making more tangible asks and being more specific than being so broad were some of the areas in regards to that example that people have highlighted. But I think it's really a multitude of the platforms you stated. So whether that's social media, writing a letter to the editor and an op-ed, videos, I think that really people consume information in different ways. And a lot of it is also doing that direct one-on-one discussion with individuals that I think is important. When I talk to legislators, I always try to put a patient story in there. So I always try to bring it in how whatever I'm advocating for, how it's impacted my patients or their families. And so I always really go back to that. When I'm writing more to the public, I kind of want to set up this is why I'm an expert in this. And when I've helped other people write op-eds, you know, whether it's say it's on like firearm injury prevention, we have a pediatrician who's like a former intensivist who's cared for many people who've been impacted by firearm injury. So making sure that you highlight that expertise and then sharing those stories, I think is really impactful. But I think, you know, it can be a variety of platforms. I think you have to do what's most comfortable for you. I mean, maybe you're not on the social space. That's fine. You know, maybe you do like to write more print media. So, you know, do that. Or one of the tips I like to share, I have a friend who's a great advocate at Mayo Clinic. She is self-professed introverted. And so she'll call her legislators in the middle of the night because she knows that they won't be there, but they record messages. So she just calls in the middle of the night. She has her script of what she's going to say. And she usually calls it like, you know, before she's going to bed at like 10 or 11 o'clock at night, because she knows that they'll listen to the message, but she maybe doesn't exactly want to speak to the person, particularly in the beginning if you're doing advocacy and you're like, oh, well, what if they're going to ask me a question and I don't know? It's just like in the practice of medicine, it's okay to say, you know, that's a good question. I'm going to do some more research on that and then I'll get back with you. It gives you an opportunity to then follow up with that policymaker, and then you have to make sure that you follow up. And then in the future, I think it helps build that relationship so that when they have a question again, they'll reach out to you and ask for your input. And that's really kind of the goal that you're striving to get to, because if you can have policymakers reaching out to you when they're crafting policy, then you can really weigh in on making sure that the policy is as evidence-based and, you know, relates to whatever your ask is, and how it benefits individuals. So you can really weigh in at one of the very earliest stages. So it's a really good question. I think it depends upon the situation and what you're most comfortable with. And there's different ways that you can do it, from, you know, like I said, calling your legislator, going to meet with him in person, and what you feel more comfortable with, whether that's social media, print media, or just, you know, talking to your group of friends, or to, you know, your small, you know, whether it's your classmates or whatever. There's been a lot of advocacy that I do within organizations like state medical, for example. When I first joined, I didn't feel like they talked a lot about child health issues. And now, like, maintaining our immunization policy is one of the strongest advocacy point we have. Like, that's our public health priority. And so a lot of times you have to even advocate within your own organization, whether that's your school or an organization that you're part of.
Yeah, thank you for the answer, Dr. Costello. I completely agree, especially with like the kind of inaccessibility of science and medicine sometimes. I think that's kind of one of our areas that we could improve on, is kind of explaining things in a way that makes sense to the public. So thank you for that.
Thanks for the questions. Thanks for all the questions. They've been great.
Yeah, well, thank you so much, Dr. Costello, for joining us today. We're kind of at the end of the hour. So to wrap things up, do you have any final words you want to say for maybe medical students or people in this election year about advocacy? And would you want to give a plug for your Twitter so people could follow you?
Sure. So, well, thank you so much. This is admittedly the first time I've walked with a future doc, and it's been a great experience. Thanks for having me. I would say it's never too late to advocate. Remember, advocacy is a marathon, not a sprint. And wherever you're at in your stage of training, you make a difference. So your voice really makes a difference. So if you haven't already, make sure that you have a voting plan, or make sure that you've already voted. Get your flu shot. And if you want to follow me on social media, my handle is at Lisa Costello WV. So I look forward to seeing you guys in the social space. Everyone stay safe. We'll get through this together. But thanks for all that you do and for walking with me this morning and learning a little bit about advocacy.
Yes, thanks again. And if everyone wouldn't mind, just right now, before you leave the call, if you could write in the chat where you're walking from and who you are. We're trying to keep track of how far our program reaches. And so thanks so much again, Dr. Costello, for inspiring us today and educating us a little bit more on how we can be good advocates in medicine. So everyone stay safe and have a wonderful weekend.